get ready to take control of your healthcare. Here's your host, Ray Cobra.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Cobra. I am your host, and I have with us today Stephanie Koch, human resources woman extraordinaire. Welcome to the big show, Stephanie.
Thank you. It's quite a greeting.
Well, hey, I try. So we crossed paths at Rosetta Fest this past September, and you were kind enough to come on the big show. And I'm always fascinated with HR people. It's kind of, so my background being in the benefits industry, starting with Aflac back in 2001, shortly after 9/11, all the way on up to this day. HR is a vital pipeline for us. It's kind of, we need to work together with HR in order to fulfill our mission. And whether you're a voluntary employee benefits provider or really anyone that has anything that is team member facing, HR is the conduit to employees. And so it really, at times it can be trying as someone who's trying to break into an organization, because HR typically has very strong gatekeepers, because if you didn't, you wouldn't get anything done.
Yeah.
And so there are some frustrations, on the broker consultant employee benefits side in trying to make a breakthrough. And I'd love to talk about that a little bit. But before we go there, how the hell did you get into this racket?
Well, I love this racket. It's become a huge passion of mine over the past few years. I've actually been working in human resources over 25 years. And when those words come out of my mouth, I'm like, how the hell did that happen?
I'm right there with you.
Yeah.
Time flies when you're having fun.
Yeah. And, what's interesting is for so many years, when I first got into HR, I was working with companies that had fully funded healthcare plans. And, initially when you're starting out in your career, you're there in a meeting to listen and you're absorbing information and you're learning. But as I got more immersed in those fully funded healthcare conversations, I remember thinking, there's something about this math that doesn't add up. But again, I didn't know enough to understand what it was, but something didn't seem right. And then I moved and I was at an organization for 11 and a half years. We were over 700 employees and we were always fully funded.
Well, so take me back. I'm sorry to interrupt, but I want to go back a little bit further.
Yeah.
How did you get there? Was that like your first gig out of school, or how did you end up in that position?
What's so interesting is I grew up in New Jersey, and I decided when I was about 21 years old, I was going to go back to college. And by that point in time, I was working full time as like an executive assistant for a paging company. Do you remember pagers?
Back in the day,
back in the early 90s.
Yep.
And I was there and I thought, I want to do more than this. Like, I know I can do more than this as a career. But it was at that point I really I knew I wanted to work with people because, we were supporting employees in the organization. And at that point, it was more simple, answering questions about, vacations or a little bit about benefits. But then I moved into another role in early 1994. And that was when I started as an HR rep. And that was when I really started connecting the dots. And at that point, I was doing more onboarding and, explaining company benefits and stuff like that. But then I had an opportunity to move to Tampa. I was asked to relocate because remember, I grew up in New Jersey, graduated from college when I was 30 because I went to school for 9 years at night. I was tenacious. I knew I wanted to finish because I knew it was important to have my degree. So when I was 30, I was asked to move down to Tampa to be a regional HR representative for this large company I was working for. And unfortunately, about a year after we moved to Tampa, the company went under. So being that we had made the move and we realized that the cost of living at the time in the early, 2000s that was much more reasonable than living up north. We decided to
Sure.
make a go of it, and we stayed. And I ended up working for this company. That's where I was working for 11 and a half years, where we were fully funded. And, that's when I really started really grasping healthcare as best as I could. Um, from there, back in 2013, because I worked there for 11 and a half years, I went to a company that was self-funded.
Mm.
Now, right, the whole thing about self-funding is when HR professionals are trained in human resources, practical, application, we're not necessarily trained on healthcare strategy per se as we know it
Mm.
today. It's really like, okay, you can be fully funded or self-funded and you should offer benefits,
Yep.
right? So the thought of working with a company where I was going to be the VP of HR and they were self-funded, I was like, all right, well, let's see what happens. I was a little nervous, but all that
Yeah.
being said, I always knew something was innately going on with healthcare. I just couldn't put my finger on what it was. So when I started working there, we were self-funded with one of the big carriers. I'm not sure if I can say it, but one of the bukas.
We could name names if you'd like, but one of the Bukas
We're
will
going to name
suffice. That's
drop.
fine.
Yeah. So we did that. And then back in 2016, after doing all the strategic things that the broker at the time thought we should do, and we were doing what we thought we should do to help, steer the healthcare plan to a healthy renewal, lo and behold, even though we were self-funded with a big carrier, and despite demographics and really what we thought were decent claims based on what we could see, even though it wasn't a lot, right?
Mm. Yep.
We got an 18% increase. And to answer
Ugh.
your question, it was at that point, it was very pivotal for the company I was working for because, some companies, when you get those kind of increases, when you think about it, it's not sustainable because 18% one year is going to be compounded year after year, despite whatever amount it is. And it
Sure.
was at that point that we were looking at a plan with reference-based pricing. And it was something that I was not familiar with. And we can get into that part of the story after, because some of the executives went to a benefit symposium and were learning about it and brought it back to me. And, because I didn't know any better, I said, hell no, that is not a good idea. And I don't think that's something you should do. So that was
Thank
my
you for
first
your honesty.
reaction.
Ladies and gentlemen, that's an honest answer.
It's very honest because that's what happened.
That's usually the gut reaction, right? It's human nature. It's fear of the unknown. It's like, well, wait a second. Like,
Mhm.
I'm not so sure. We're going to have to talk about this and unpack it a little bit. Yeah.
Yeah, and that's where the story of my love for healthcare really started. But there was definitely that moment of this is something that is so unfamiliar. I've never heard of it. I work in HR
Right.
and I'm supposed to be the one, to really understand all this, you know.
And give me the time frame again. What year is this?
So this is 2016.
Okay.
And that was when, again, despite doing all this stuff with the carrier being self-funded, demographics weren't bad. We had a group of 450 employees. I think we had about 600 covered lives. But,
Mm.
you know, despite doing what we thought were the right things, we still, like I said, got the 18% increase, and that's when it took a turn.
Right.
And
And so
and
what
really, it was the
was
best turn of my career. I just didn't know it back then.
So did you and that is funny. The execs went to a conference,
Hmm.
they were intrigued, they wanted to learn more. They came back and said, we'd like to do this. And your immediate reaction was, let's pump the brakes, which is understandable. Um, what is the dynamic between you and leadership? Are you typically plugged in and interacting with the CEO, CFO on a regular basis, more the CFO? Um, in your experience, how important is that dynamic and communication between head of HR
Hmm.
and leadership?
I will tell you that I have been very blessed to be very included as part of executive management, even
Mm,
being in HR, because HR has such a huge value proposition. I mean, healthcare itself being the second or third largest line item that a company has. But if
yeah.
you think about all the programs that HR has to facilitate and be responsible for, there is a lot of opportunity for, and I always say this, HR can really be a profit center and stop being looked at as a cost center. But it's super important that HR is plugged into, leadership, and that they show and validate and show the value that they add, because every HR
Yeah, let me
person,
let me let me interrupt you
yeah,
again there. So I love that you just said that because that folks, pay attention to what Stephanie just said. HR should be looked at as a profit center, not as an expense.
correct.
That is huge, and I'll tell you why. What kind of prompted my interjection. I recently had the pleasure of interviewing Rob McKinney, the former CEO of Raven Alaska, who we took on as a client. It was a co-consulting deal between my firm and ePowered Benefits with David Contorno,
Hmm.
and we took them
I'm
down the
familiar with
path of
Raven.
reference based.
Yep.
Yeah, we took them down the path of reference based pricing and direct primary care. And at one point in the interview, I told Rob, I reminisced with him that we saved them 1.3 million in their first year on basically a $2.8 million spend, $2.7 million spend. It was a hair under 50%, and in the second year, added $1 million on top of that. And I asked Rob, I said, "How many airline tickets would you have to sell to realize a $2.3 million net bottom line
Hmm.
profit?" And he said, "Well, I haven't done the math, but we fly pretty small planes, and so a lot of tickets."
Yes. Yeah.
And so I really think that you hit on something that is huge. It's very key because let's face it, folks are, remind me, what is the name of the organization that you are with now?
So I currently work for Hendry Marine Industries, and
Yep.
Hendry, I want to give a little background and to put context into who we are and why, when we talk about our healthcare story and the successes we've had, it's so important. So Hendry has 300 employees. 80% of those employees are men. Our average age is late 40s, early 50s. Now, a lot of people, when they look at Hendry Marine, it is a shipyard. We have two operating entities under the Hendry Marine holding company name. So it's a lot of production, blue collar, manual work. And, our story of what we've been able to do is really, really been the most exciting work I've ever done in my career.
That's
I just
awesome.
love it. That's why I fell in love with it, because, as an HR professional, we have ability, like you said, because we're so plugged into companies, we can have an impact, to have our company be profitable, whether it's healthcare. I mean, that's a huge one, of course, but recruiting, retention, so many
Right.
areas.
And it's highly impactful. So for folks that are kind of I'm going to use the word distracted by their primary
Mhm.
function and driving business and sales and focusing on all the things that you would excuse me, typically focus on to grow a business, drive revenue, and create profit, which is the function
Yeah,
of any organization. You have at your disposal, it's kind of the low hanging fruit, a lever that you could pull on to immediately drive savings through one of your biggest expenses,
yes,
healthcare. And if you can do that, the ripple effect of that, not only in the net bottom line savings effect, which is significant, but to your point, now all of a sudden, if you're doing it the way that it ought to be
right,
done, and yet you have folks that you're incenting to find the highest quality care possible, and when they do so, you reward them with the lowest costs. And I don't want to steal your thunder, but I know that that's kind of where you're going. Amazing things happen, and people tend to stick around. They feel appreciated. It's easier to, recruit. And let's face it, recruiting isn't an easy
It's not
game.
right now.
But if you have an environment where the folks that you have are happy, the greatest recruit is a referral from an
Exactly.
employee that's in the
Mm-hmm.
organization, right? So if you're creating that environment, and kudos to your leadership for recognizing this, because so many miss the mark and they just kind of blindly put their faith in a broker or an advisor. They budget for the increases, and that's a game that's got disastrous consequences. It just
It does.
does.
And what's so
And so,
interesting is that, so I was working for that other company prior to coming here, and I worked there for about 6.5 years. But the last 3 years that I was there, we had actually gone from the BUCA self-funded to reference-based pricing. And, we just flipped the script after. It did take, I will say that, like I said initially, I was concerned because it was not something I was familiar with. So I'm a show me person. So if you're going to do something to disrupt what my employees have come to appreciate that we offer, which is benefits, I am protective of my
yeah,
employees. So, my mantra was, it's great the company's going to save money, but is it going to have an impact on the employees? Because it ultimately does and could have an impact on turnover and really disruptive workplace. So after
right. And that's an important
yeah,
point, because if you're not focused on both of those things, it's a two-pronged,
absolutely.
issue. There's savings, net savings to the
Hmm.
bottom line for the organization, but then simultaneously, what is the employee experience going to look like? And listen, sometimes being head of HR, being a business leader, it's almost like being a parent.
Absolutely.
Sometimes you have to make tough
Hmm.
decisions for the benefit of your children, to use that
I always
to
say that, and
continue with
people are
that
like, how many
analogy,
kids do you have? And I said,
right?
one biological and 300 adopted. That's like
Right,
basically,
there you
it is
go.
true because I'm very
So,
protective.
yes, and they're not always going to like what mommy and
Correct.
daddy have to say or do, but ultimately, that you've done your homework, you've done your diligence, and the last thing in the world that you would do is put them in harm's way or make a decision that's going to be detrimental to
Absolutely.
their health,
Right.
right? And so if you are not focused on both of those things, and you're not aligned with an advisor that is focused on both of those things, you're in for a rough ride.
Yeah. And
And yeah,
Unfortunately, we had worked with this broker partner at my last company for many years, and I admire them to this day. They're brilliant. However, it wasn't them that brought us, this reference-based pricing program. And RBP is a tool, right, to help
right.
facilitate cost savings. So we ended up switching brokers, and that's always a tough decision. But what I find interesting is companies will stay with a broker despite the fact that they're paying too much for their health care. It's like, oh, well, it's the CEO's golf buddy or it's the brother in law. And I'm like, but,
I wish I had a dime for every dime
but I'm,
every
I
person that
mean, business is
I've heard that a
business, right?
million
So your
times.
buddy's going to go play
Right.
golf with you tomorrow if you break up, you know?
Let's hope so, if he's a true
Yeah.
buddy.
So I just find that really odd. But anyway, so from 2016 to 2019, we're doing amazing on this plan. We went through a very successful transition from, the BUCA self-funded plan to this plan. But then in 2019, I ended up losing my position because they ended up downsizing. So I
Oh,
can't remember if I told you this, but I went on the broker side for a little while.
you
So
did. You did. Yeah. Tell us about
Well,
that.
I just fell in love with healthcare strategy because I had a different perspective having worked in HR. So I understood how to, put together communication strategies that were successful, what I think would be meaningful for the employees to hear from the employer perspective. And unfortunately, that was, only a few months. And I ended up going back into HR consulting. Now, that's how I ended up at Hendry. So I come to Hendry
Right.
to for my company that I was working for to be considered for a consulting position, and they were looking for a fractional HR director. And I was talking with them and I said, they were interviewing me as I was interviewing them. I think it's always a two-way street. And I
Sure.
asked what kind of benefits they had. And the CFO looked at me and he said, well, we just went to a new insurance program last year, and it's still something that the employees are trying to adopt and adapt to. And I said, what is it? And he said, well, we went reference-based pricing and so on and so forth. It was the same exact program I had just left. So you
Wow.
talk about the stars aligning. And when I said, oh my God, I love that plan. It has been so successful. I've been working with this. It was like Coach sign me up
Right.
kind of thing. And they looked at me
Yeah.
like I was crazy because I don't think they ever thought they'd meet someone who understood it. So when I started December of 19, then I just took over. But what was interesting was they
Y-
went RBP, and a change like that is a big one, right? Because there's always the transition,
Yep.
the change, the name on the card isn't the same as what we're used to seeing. So there's a lot of um, adopting and adapting for the employees. But um, they went reference-based pricing with Imagine 360, but then they kept the CVS Caremark PBM. And again, it's a stair step at the time. So
Mm-hmm.
when I got
Yeah.
there, at the end of 19, the decisions for 2020 were already made. So I had to ride it out. But January of 21, be rest assured that, CVS Caremark PBM went out the door, and we brought in our own PBM that I'd worked with previously who did a great job. And off the bat,
Yeah.
30% savings.
Wow. Yeah. It's really funny because they did it backwards, right? So RBP is typically the more disruptive,
If
if
not
in
communicated
my view.
properly, yeah,
Correct. In my view, if you're going to transition from fully insured away to level funded, let's say, and RBP is the only thing that you change or the
yeah,
first thing that you change, that can be incredibly disruptive. I remember having a conversation with a guy who's a longtime client of mine on the voluntary side of the business, and it's a big name
yeah,
financial company in New York, based in New York City. And I advised him against going full RBP from fully insured. And I am not the broker of record. They hired me to do some
yeah,
consulting work and, strong long-term relationship. And he was mad at me because I pushed against going RBP as a first step. And I was like, buddy, I won't use his name. You have no idea. Like, you work with a prima donna employee base. These people are used to having everything handed to them. And if you go from fully insured United Healthcare to RBP in the New York City market as step number one, you are going to regret it. And so he was upset with me, and I said, look, there's a glide path from fully insured to RBP, and sometimes, and to your credit, if it's communicated properly and you have someone who's a
yes,
champion of it, as you are, who kind of understands the
yes,
mechanics, can it be done successfully? Yes, without question. But if it's your first experience
yeah,
with RBP and you're doing that as step one, changing the PBM is infinitely easier because there's not going to be the same member disruption. There might be an inconvenience here, an inconvenience there. If the handoff isn't done properly, which it
right,
always must be done properly, by the way, but if it's not and someone misses a prescription fill, that can have medical consequences. You never want that. But barring that little, I'm going to say 30-day, you want to go crazy, 60-day
yeah,
buffer period. After that, you're off to the races. And to your point, pharma represents 20 to 30% of claim spend, which represents 80% of
right.
overall spend. And in our experience, 30 to 60% savings in the PBM space is not
Ours
uncommon at
is
all.
ours is very low. In fact, we just did a review and it
Yeah.
was, if I remember correctly, it was like maybe 10% of our overall spend. And that's because,
Mm,
when you have control of the plan being self-funded and you don't have an
right.
off-the-shelf product that you have no control over and you can't fix and you don't have data, you don't know what the hell's going on in your
Right.
plan, you don't know what to fix. So,
Yeah. And sometimes it's not in your control. It
yeah,
depends on your population. If you have a population that is managing disease and illness, which is
yeah.
often the case, then pharma could be a higher percentage of spend. And if that's not the case, it could be a lower percentage of spend. But when you look at it on a, PMPM basis, per member per month, it's not uncommon for us to drastically
And we did
reduce those
initially.
costs.
Hmm.
Yeah, because there's so much. It's just a system that's fraught with waste and
Yeah, and
abuse, and
I
so
was going to
yeah,
mention that, like, as an HR person, like, having to understand and unravel what, we're trained that, even as people who live in the US, right? So we are trained that there are these big companies, and if their logo is on the card, you have the best insurance.
we have the
Right.
best healthcare in the
Not.
world.
But but if you think about how many
Yeah,
years people have believed that, and as HR professionals, the people that we have been partnering with for so long make us believe that we have, the best healthcare in the world,
right,
which are the bukas. But
right,
now what I had
right.
to do when I was trying to get my mind unraveled from what that was, because I was like, well, if I can have a similar plan self-funded, what does that look like? I needed to have a visual of what that was. And I remember I helped
Yeah,
the new broker at the time create this diagram, and it was like, here's what your current plan looks like, here's what the new one looks like, and essentially it's the same. You're getting the same products, you're
mm,
just able to select who's going to support your plan. So
yeah,
that's how I was able to
yeah,
interpret the difference between the two and really understand it.
yeah, yeah. Well, I think again, it goes back to the stigma of, you know, the just that badge of honor that this is America. Of course, we have the best healthcare in the world. Of course, we have the best healthcare on earth. And to an extent, that statement is true when you look at some of the amazing innovation that we have
Absolutely.
and access to some of the best physicians and surgeons. Yes, I would agree with that. But if you're a student of the game as we are, and you go to the conferences and you read the books and you hear from
Mhm.
MDs, you just know that mathematically, statistically, it's not so. We rank pretty
Right.
low on the list of developed nations for the quality of our healthcare, and we spend the
We
most by
do.
far. And so, yeah, it's an eye opener. Like I'm sure you must run into
Mhm.
colleagues of yours. I'm guessing
Mhm.
you're a SHRM member, and you go
Yep.
to those conferences, and you must run into people that are just like dumbfounded by you doing what you're doing because they're still in that mindset of, hey, we're in a fully insured
Yeah.
plan. It's as good as it gets. And you have to chuckle to yourself
Well,
and say, well,
I feel very
th-
blessed to have learned this like 8, 9 years ago, because it really opened up my eyes to not only opportunity for the companies I was working for, because really I'm the kind of person, like, once I have information, I feel compelled. I feel
yeah,
compelled to
yeah,
help HR professionals really come along in their knowledge of healthcare. I think it's so important because, like I
yeah,
said, we're not taught healthcare strategy as a topic. What does
yeah,
that mean? And it's something that, having had the last several years of diving into it, I'm like a mad scientist now when it comes to renewal, and I'm, looking at the plans and, what can we do to facilitate change.
right.
But, after I got here in December 19, made some changes in 21, and, we had $1 million surplus at the end of 21.
Mm,
I mean,
nice.
who over accrues $1 million
Right,
for
right.
healthcare? So having that money to reinvest back into the plan in 22, and then in 22 we had a half a million, and a healthcare plan, and this probably, it has its run time, right? because at some point after 5 or 6 years, you know, we had a bad year in 24.
This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today.
So, we did tremendous for several years consecutively, but every healthcare plan, has a day or a year where it doesn't perform so well. But that's why being self-funded and having control of what's going on in the plan is so important, because you know what lever to pull to help mitigate some of those things from happening in the future.
Yeah, let's talk a little bit about that. So, one of the brightest minds in healthcare that I've come across in my travels and being a student of the game is a gentleman by the name of Kevin O'Kane. He founded J&K Consulting out of Pittsburgh, Pennsylvania, and it's now Catalyze Health. Brilliant guy. He learned healthcare. He was a Mass Mutual rep in the late 1960s when Mass Mutual was in the game. He
Wow. Okay.
lived through ERISA. And anyway, long story short, he's just brilliant guy. He's an actuary, so he's a brilliant mathematician, knows the numbers inside and out.
Mm-hmm.
And he said to the audience, the only way to lower the cost of healthcare is to manage the costs prospectively. You have to manage the costs in advance.
Yeah.
And healthcare has a supply chain, just like anything else that we procure. And when you're in a fully insured plan, you have no mechanism to manage healthcare. And to your point, you will run into a year or two, typically it's 1 out of 5, 2 out of 10,
Yes.
where your claims are going to run hot because we're human beings and people get sick and the cost of care is extraordinarily high. And so you will run into that. But the truth of the matter is, if you're in a plan such as the one that you have now, you are in far better shape to control those expenses in advance than in a fully insured plan and getting blindsided by a 30-40% renewal. And
you have no data to support it. Like, where is the claim data to show that your utilization exceeded premiums, or like what is going on to even control it in the future? You have no idea.
Sure. And, just go back to the PBM example in pharmacy. We have clients that we've gotten onto the Patients Assistance Program with the help of our PBM. And we've taken a cost for a drug like Humira, which could run into 6 figures a year, and we've reduced it to nothing, 0 for the plan and 0 to the member. That is a win-win.
That's huge. And we did something similar for, because I understood the mechanics of alternate funding and, the experience I had before brought here. And when we switched PBMs, we went full, PBM, international pharmacy, alternate funding, specialty pharmacy, and then of course the primary care clinic we brought on site in 22, but that's a whole different story.
No, but so to your point, when you are in a plan that's a custom plan that's structured like the one that you're in, and folks who are tuning in might not know what you mean when you had $1 million surplus, but essentially you are paying into your plan. You're level funded, I would imagine.
No, we're self-funded, and we have stop loss, and our spec deductible is $95,000.
Got it. So you're paying your claims as you go?
Yes.
Month to month.
Yes. And we actually, we do fund for max loss. So some companies, will change that.
That's what I was getting at.
Yeah.
So you're funding the plan to max loss, meaning that you're paying as if it's your worst case scenario.
Correct.
And then at the end of the year, there's a reconciliation. And by the way, you can see the data in real time. So if your plan is running cold or if it's running hot. And in your case, your plan is running great. And so the end of the year comes and I don't know what the spend is, but let's say it's a $5 million spend in terms of what you paid out over the course of the year. You end up actually your claims and administration and everything ends up being $4 million. You
Yes.
have $1 million that you overfunded essentially.
Yes,
And
that's exactly right.
what happens with that $1 million?
So in that case, we did a couple things. Number one, we actually invested in an on-site primary care clinic, which we'll get into, but we
Mm,
also it helped us pay the claims for 2022.
okay.
So it's pretty interesting because, you then you're starting out ahead.
Right. Right. That's amazing.
Yeah.
So, it was Warren Buffett that said that GM is a healthcare company with an auto unit attached.
You know what? You
Right.
know what's so interesting? You said that because, and I
Yeah.
can't remember who I heard this from, but they were talking about the fact that healthcare should be almost reviewed and purchased by like a corporate purchasing department. Like, why is it they can purchase everything else,
Yeah.
and like
They're
who
starting to. There are some organizations that
are
are
there?
actually going down that road. Yeah.
Yeah, I
Yeah.
thought that was really interesting, but certainly that could cause other issues
Well,
of,
think about some of the enterprise organizations out there that have 100,000 plus
yes,
employees. They're spending north of $500 million a year on healthcare. That becomes a lot for an HR person to manage, even a savvy HR person, and they could still be steering the ship. But at
right.
that point, I think you would say, you know what, we'd probably benefit from a team of expert purchasing, folks to help us with this. And
Yeah,
and I think, yeah,
I've even thought to myself, because I spoke at a CFO conference in Boston a few months ago, and we were talking about what an HR professional or the model HR person should look like now versus what it was thought to be even like 5 years ago.
yeah,
And the question and the conversation about, well, number one, it should be somebody that does have some financial background, but they should also, have a dotted line to the CFO, definitely work directly with, the CFO, but also companies that say they can't afford to have someone working in HR to focus on healthcare. I said, you can't afford not to.
yeah,
That
yeah.
was basically what I told them because they're leaving money on the table.
1,000%. And again, it's the low hanging fruit. Folks get caught up in, I'm not saying the wrong things, but they're focused on their business. You and I eat and breathe this every day.
Yes.
So they need to, at least if they don't have the bandwidth, they need to have someone that they can delegate this to that has P&L responsibility
Right.
or a sense of P&L responsibility.
I
It
mean,
can't be. And what would you say the odds are? I don't want to put you on the spot, but if I said, Stephanie, in your experience, what's the percentage of organizations in the United States that have their broker because of a personal
oh
relationship
boy.
as opposed to a benefit to the organization? What would you guess?
I would say it's probably a higher number than we want to think about. I mean, if you're putting, I mean, I'm trying.
Would you say without putting you on the spot, would you agree that it's more than likely north of 60%?
Yeah, I was going between 50 and 60.
Yeah. Yeah.
I
I
mean,
think that's just the God's honest truth.
mhm.
Because if you look at it, and these are not bad people, by the way. I'm
No,
not trying to say
they're
your
running a
broker
business just
sucks.
like everyone
Of
else
course.
is. Yeah.
Yes. And so, brokers are usually smart, charismatic, friendly, funny. You
Oh,
develop a
yeah.
friendship with them, and that's all fine. But this is one of the biggest expenses that you have in your organization. And the reality is the boots on the ground agent, broker that you're interfacing with is more than likely not calling the shots, particularly if they're, working for one of the large privately held firms or certainly one of the publicly
Right.
held firms. The decisions about strategy are being made at the top of the food chain level in
Yep.
those organizations. And so it's just simply not in the best interest of their organization to move to a model like this, because at the end of the day, and you could
Well, it impacts
disagree,
the
but
revenue. It impacts everything.
what
Yeah.
we're doing is we're cutting all of the fat out of the plan,
Mm-hmm.
and we're saying, here is the net bottom line. Here's where all the bodies are buried. It's one of the things that I really like about being a next gen advisor and now being a newly minted Health Rosetta advisor.
Oh, congrats.
Thank you. Yeah. But the goal and the mission
Mm-hmm.
is, look, I have a good friend, who I know since I'm a teenager. I was bartending in college. My first gig was on Bleecker Street in the West Village at a
Nice.
little French Swiss restaurant called Le Servant. And my buddy Neil, brilliant guy, graduated, so he's Cypriot, came here first generation, amazing work ethic. To this day, one of the hardest workers I know. And, I met him at Le Servant, and where was I going with this? He's totally got distracted. Shiny. So he, I'm having a senior moment.
No, hey,
moment,
we
ladies
all
and
have
gentlemen.
them. And I'm older than you, I'm pretty sure. So.
Oh, I don't know about that, but anyway, so, oh my God, we're gonna have to edit this. What the hell did he say? Where was I going with this?
I'm trying to remember too.
Finance background.
We were talking about like relationships and brokers and. Cut.
I'm gonna have to switch gears. Yeah, we're gonna cut that and come back.
Cut that whole piece.
Yeah, so your broker essentially is, you should think of your broker, in my opinion, as someone who is sitting on your side of the table. They should be kind of the sixth man on your team, if we're using like a basketball analogy. Someone that they're going to show you the good, the bad, and the ugly. You know where every dollar of compensation that they earn comes from. And should they be paid, and be paid well, for doing what they do and being a Health Rosetta next gen advisor, someone that's working and operating in the fiduciary interest of the organization? Absolutely.
Right.
But what happens in healthcare is you have a system where there's misaligned interests, and brokers are being paid from insurance carriers persistency bonuses. So, you have, 1 million lives with us. If next year you have 1,100,000, we're going to bonus you. Well, that shouldn't be the case.
Well, that's the whole thing. So essentially, they're getting the incentives from the wrong people, right? So they're getting paid rather than offering the incentive to the client or the prospect and saying, I'm going to do this performance, I'm going to perform this for you. And this is what I am, committing to you as an organization. This is what we're going to do. And you hold us accountable, and it's transparent. Then it's aligned properly because they're working for you, the company, rather than the healthcare company.
Yeah. And so I had a friend, Neil, back in the day. He was a waiter in a restaurant. I was a bartender in college. I met him there. And brilliant guy, Cypriot guy, came over, first generation here, best work ethic of anyone that I've ever run into before. And he was also involved in construction. He did a bunch of different things. Brilliant guy. And he said, Ray, you should not feel bad about hiring a contractor and asking a contractor to break down, their services. How much is this going to cost in labor? How much is it going to cost in material? And what's your profit? And that lesson I carry with me to this day. Like, that's something that you deserve to know. And if you feel like I'm making too much money, then we can have a discussion, and I'm going to have my price, and you're going to have the max that you're willing to pay, and maybe it's time for you to move on to another advisor. But I like the idea or the concept of, I don't want to accept a bonus from the insurance carrier.
Right.
I would rather accept the bonus from my client when I do what's in your best interest, namely lower costs and elevate the quality of care. And I think that's what's missing from a lot of broker client relationships out there. And they also get caught up, I think, in, the fancy spreadsheets and the pie charts and they sell themselves on service. And I'd like to ask you, like, how important is that? How important is it to have, a broker that is heavy on spreadsheeting and analysis? Is it super important, and can you not do without it, or where does that kind of fall on the spectrum?
Yeah.
And I guess my real question, what I'm getting at, is there are many, many small brokers, independent healthcare advisors out there that I think do exceptionally well at designing custom plans and
Right.
helping communicate the way that those plans operate with the help of HR, kind of uniting as a team
Hmm.
to the team members and delivering savings. And when I look at the flip of that and I say, well, would you rather have that as an employer organization, or would you rather have, kind of, I'm going to say peace of mind because I don't have a better way to phrase
Yeah.
it, of being with a multi-billion-dollar company where your rates are increasing every year, but they have this army of people and staff behind them. And by the way, there are many independent broker advisors that have access to all of those same resources, but it's not housed under one roof. They don't have them on payroll. But just what's your thought process on that? How important is it to be with one of the giant guys versus one that's more aligned with where you want to go?
Well, I mean, for me, that's obvious. So, we work with One Digital. They've done a great job with us and for us. And we want to work with vendor partners where we are going to feel valued and we're not going to be like a small fish in a big pond.
Mm-hmm.
You know what I mean? Like we have
Yeah.
to feel like, when they are meeting with us, we don't want to feel like they took the same presentation and just kind of pasted our name on. It has to be customized. And
Right.
that's where I think it's meaningful is if you are a broker advisor, you have to understand the client or the prospect you're meeting with. You have to know the employees, the culture, and build a plan that really supports that. It's not a one size fits all
Yeah.
because not every client or prospect has the same challenges. Cost is one thing, but how to solve for the cost is going to be different based on the client.
Right. Right. And
But I like having so me now I'm like a healthcare nerd all these years later.
yeah.
Like I personally enjoy seeing a lot of the data because then that helps us know what lever to pull and know what strategies we have to implement to help mitigate our costs and you know kind of gives us a roadmap for where we're going in the next couple of years.
Yeah, no, data is definitely key
Yeah.
to understanding and controlling costs. And the reality is, most independent healthcare advisors have access to data through their partnerships with
But it's what they do with it that
TPAs, et
matters.
cetera. Yeah. Well,
Hmm.
so unpack that and explain that.
Well, so I want to talk about our primary care clinic because it's actually one of the biggest things like
Look
that
at the
I've done
smile
in
on your
my
face. You're
career.
excited about
I
this.
know I like light up like a Christmas
Talk
tree.
to us. What exactly is that?
Um, well, and it goes back to mid-year of 21. We're doing a mid-year review, and we have our data sets, and I'm like digging into it, and glaring on off the page is the fact that only 15% of our covered members of the healthcare plan were using the preventative wellness benefit, which is covered 100%.
Mm-hmm.
So going back to what I was talking about with Hendry as a company, 300 people, 80% of them men, late 40s, early 50s. I'm thinking to myself, we have a bunch of walking, ticking time bombs walking around because no one's getting the basic preventative stuff done to know
Yep. And
really a baseline health screen.
and they're about at the time when stuff starts to break.
Well, that's the thing.
Right?
So
Yeah.
just
Yeah.
understanding that, having been around the block for a long time, we were saying, okay, we have to solve for this problem. We knew that that was an immediate thing we had to solve for. So in the next month or two, I'm at an HR conference and I come across Walk On Clinic. And I don't know if you know Chris Yarn. He's Frank Mike Droppa on
Oh, okay.
LinkedIn.
Yeah, yeah.
Yeah. So that's his company. And I end up looking at it and I said, that's what we need. Because we were going to do a brick and mortar, right? But building it yourself is very expensive. The ROI takes too long. There's just a lot. We had to move immediately. And the near site clinics weren't going to work for us. We just didn't think it was a good fit for our culture. So when we saw that, we decided, okay, we need to do this. Now, this is August of 21.
Mm,
By January of 22, they are on site.
wow.
And we went live. And this was the greatest part of the story. And like I said, one of the best things that, I ever accomplished in my HR career. And, you know, one thing about, I'm very optimistic. Like I'm always happy for the most part. I'm like, okay, so we're going to put this here.
Right.
It's primary care and everyone's going to use it. Well, that was not the case. So I'm doing all this FAQs and I'm like trying to answer, like I'm thinking ahead,
Right.
like what I think the employees are going to ask. And the one thing I didn't consider was the employees feeling untrustworthy of why the company wanted to know what their personal medical issues were. We didn't have much utilization to begin with. So literally I'm thinking on my feet and I'm like, okay, we're going to hold a contest.
There you go.
And basically, and I'm making, Ray, I swear to, I'm making this up as I'm going along. And we're like, all right, from January to April, anyone who goes for their preventative wellness visit at the Walk On Clinic, they become a patient, is going to be entered to win 5 days of PTO.
Wow.
That's a week off with
Yeah.
pay. All
Wow.
you have to do is go get your wellness exam and your name will be put in a drawing. We'll draw one winner at the end of April.
I love that. So you're
Well,
not only an HR exec, but you're an entrepreneur.
apparently.
Yeah.
So this is the best part of the story.
Right.
So it's incredible. So one of my employees goes in, and the doctor, and I get really emotional about it, but the doctor says to him, did you know you had a lump in your neck?
Oh boy.
Here he is trying to win the PTO, and lo and behold, he had stage 4 cancer. He had no idea.
Oh my God.
And thank God he's happy and healthy. But, had that clinic not been there just to do a preventative wellness exam, I don't know what would have happened.
Wow. That's
And
incredible.
and another employee goes in, same thing. He's trying to win PTO, and the doctor says, your blood sugar is so high, you're like at stroke level.
Oh,
So they immediately put him on, a program and get him, all taken care of. And those two employees ended up becoming the biggest advocates for the clinic.
of course.
And next thing we know, people are coming. And we
Yeah.
made it so easy. And it was very well thought out. We were very methodical that if you're an employee, you can go, it doesn't cost you anything. Your dependents can go as long as they're 16 and older. So it was on company time. The employees don't have to clock out because we knew every appointment was maybe 20 to 30 minutes
Right.
versus you think about production time or productivity. If they were
Right.
to leave the job, it's 4 to 8 hours,
Sure.
if they
Sure.
can even go to primary care.
Yeah. Well, I also think that employers tend to underappreciate what that gesture means, because if you're an employer and you believe that your employees are working every minute of every day, you really are kidding yourself. So, I always hear about the cost, the impact of productivity and this and that. And I'm just talking about with, let's say,
Yeah,
conducting a proper open enrollment meeting. Like, yes, I get it. If you're measuring, it depends on what yardstick you're using to measure, right?
right.
So I understand that if you do the math, yeah, it's going to cost you millions of dollars to take these people off for an hour. But you know what? That investment is going to pay dividends.
It
And
has long-term payoff.
look at the ROI here. You very well could have saved a human life.
We did.
Amazing,
There is
amazing.
no doubt. And it was just by simply offering preventative care on site. And it was part of the strategy that we understood needed to happen for our employees, understanding the people, the culture, who they are as, just as employees.
Yeah.
That's why near site wasn't going to work for us. We knew that. And that's why we said we need something. It literally sits on the shipyard property, and it is the most invaluable thing we've ever done. And, that started in 22, and we just finished or finishing our third year. And we have close to 100 patients now for walk on clinic, that see our doctors. We're open 2 days a week, or they are open 2 days a week, but really they are so immersed in our healthcare strategy, and they became part of the healthcare ecosystem. Like, they are tied into our local doctor network, that is covered under our plan.
Hmm.
And when an employee has to see a specialist because they were being referred by the walk-on clinic, the primary care doctor,
Right.
we get concierge service. So it's almost like the employees get to skip the line, and we get
Oh,
someone
wow.
that helps them facilitate getting the appointment.
And
And
when they go
now,
through that channel, is there a financial incentive for them as well?
well, yeah. So number one, like I said, they don't pay to go to the walk-on clinic. But
Right.
number two, when they go to the local network, because we are RBP, we have negotiated contract rates, and they're typically paying less than they would under a traditional plan.
Wow, that's great.
Hmm.
And that's the key right there, right? You have to spend some time communicating how the plan works and having employees understand what's in it for them. And at first you didn't have very good traction because people are saying, "Well, I don't want them to know about what's going on with me," right?
Right.
But the truth of the matter is, in a health plan that is a custom plan where you have access to
Hmm.
data, you can have that access de-identified, but typically it's beneficial to have someone in the organization that you designate as okay to have
Yeah,
access to the good, the
privacy
bad, and the
officer.
ugly. Exactly. But
Well,
what you don't want is for employees to be afraid, because the reality is there are laws protecting them. And if you as an employer turned around and fired someone because they're, all of a sudden you learn that, they have stage 4 cancer, God
right,
forbid, well, that wouldn't be a very good place for you to be as an employer.
right, right.
People have rights, and those laws and protections
Yeah.
are in place for that very reason. But
I mean,
having the ability to have that insight and
you
be
have the
able to,
control.
you have the control, of
Hmm.
course. Yeah.
Hmm.
Wow. Well, that's an incredible accomplishment, and one that you should be very, very proud of.
We are. And, initially it was brought in, with the thought of let's tackle the preventative wellness, but it has evolved into so much more, where we do blood work on site. And, just the beginning of the year, it took us about a year to kick this off, but we actually offer prescriptions that get filled on site. The employee or covered dependent has to be a patient of the clinic, and we partnered with a local pharmacy. We're in the Tampa area. This pharmacy is in St. Pete, Florida.
Hmm.
And we did an analysis of like the top 30 prescriptions that were filled in the prior year. And they're typically, the maintenance meds and things like that.
Yeah.
Well, we partnered with this local pharmacy, and they do 90-day fills, and they will deliver them here to the employee or the covered dependent at no cost.
Wow.
So we're paying, so we're actually mitigating some of the cost away from our PBM spend. And, we're reducing that cost even more because we're doing this. And, it entices the employee to take the medication they need to take to maintain
Wow.
a healthy lifestyle. So there are things that we will continue to do to evolve the program. It's ongoing. It doesn't just stop.
Do you know, did you measure your per employee per year cost prior to implementing this program? And do you know where it is today?
Are you talking? Well, we're still doing some analysis of it. But
Yeah.
I
So you may not have it on the tip of your tongue, but
no,
so
we're
per
still doing
employee
it.
per year cost, typically we'll look at what the national, averages are. And so for an organization that, has a pretty good spread between employee only enrolled, employee spouse, children, family, the national average is right around $17,000 per employee per year.
Hmm.
And in our experience, the best run custom plans are typically less than half of that.
Yeah.
So
Yeah,
it's
we
it's
ran
it
really well. And then, like I said, this past year we had a very difficult year for claims, and
Right.
unfortunately, some illnesses that had a really significant impact on the spend.
Yeah.
But
But you're ahead of it. You're ahead of it. And that's the
yeah,
key. You're
yep,
not learning about this at open enrollment. And, typically brokers roll in like, when there are 6 weeks left in the year with the renewal that the fully insurance carrier gave them. And it's
yeah.
like, oh, you inherited a 30% increase. Now,
Oh,
what are you
by the
going to
way,
do
it's too
next?
late for us to shop, and we have to renew.
Have you heard that before?
Yes.
It's craziness,
Mm-hmm.
right?
Yep.
So one of the huge benefits of going down the path that you've gone down is you'll never be in that position of being blindsided again. You have deep insight, and
Right.
it's just amazing. It's amazing what you could do when you put your mind to it, when you're genuinely excited and enthusiastic about what you do, which clearly you are.
Oh God,
And a
yeah.
little birdie told me that you might have actually even won an industry award. Do you have that anywhere handy?
I did. I was actually one of the top 25 HR professionals of the year from Employee Benefit News. So
Woohoo!
thi- this was well, this is one of them here,
Wow, that
and
is amazing.
yeah, that was just incredible. And back
Was
in
that Employee Benefits News? What was
Employee
that?
Benefits News, and
Wow.
back in May, myself and my HR team won Most Engaged Employer in the state of Florida from the Florida Alliance for Healthcare Value.
Wow.
Thank
Congratulations. That
you.
is awesome.
Yeah.
That's awesome.
Yeah, it's very
Y-
rewarding because as an HR person, to know that we have an ability to impact the healthcare space, just
Yeah.
by the knowledge that we learn from all of you, it's just fantastic.
No, it's amazing. How about I could talk to you for
I
hours.
know.
We're gonna have you back. Maybe you'll come to our studio in New York City next time. But in the meantime, if folks wanted to find
Mhm.
you, are you out there speaking anywhere anytime soon?
I am. I'm actually speaking right now. I'm scheduled for 3 conferences in 2025. Also on December 10th in Orlando, the Florida Alliance for Healthcare Value. It is their Best of the Best event. I'm actually
Oh
speaking
wow,
there talking about we call it the Hendry Marine story, or really how to really have a plan to have an impact on your healthcare spend and your strategy. So I'll be speaking there as well. And that's in
wonderful.
Orlando. And I am the vice chair for the Florida Alliance for Healthcare Value. So that's really meaningful to me.
Wow.
And lastly, on LinkedIn.
On LinkedIn.
Mhm.
Awesome.
But I will put the
Well,
dates out when I'm speaking at the conferences once everything is finalized.
great. We really appreciate you taking the time and joining with us
It was
today.
fun.
Stephanie Koch, Hendry Marine,
Yeah.
amazing,
Thank you.
amazing, amazing, amazing. We need more HR professionals like you. You are a shining example of what the future of HR needs to be, in my humble opinion. And thank you for caring. Thank you for being engaged. Thank you for all that you do.
No, thank you. That was a huge compliment. I really appreciate it. And that is the plan. I just want to keep getting out and having as much of an impact for my HR professional or my professions, the HR profession as I can. So I really
Awesome.
appreciate that. Thank you.
Keep up the great work. All right, ladies and gentlemen, thank you for joining. Until next time, peace and love. Peace and love. Have a great one.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.